Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering borderline personality disorder. This is going to be a very short video, but I'm going to be going over the key points of what you need to know about this personality disorder. Before we get started, as always, I'm going to ask you to please like this video, subscribe to my channel if you haven't done so already, and that's a great way that you can support me and support this channel. Also, don't forget I have audio lessons available on my website, and I am now accepting bookings for NG and NCLEX reviews. So if you're about to take your boards and you need some help, go ahead and book a review. You can go on my website, nexusnursinginstitute.com. All right, guys, let's get started. Borderline personality disorder. This personality disorder is characterized by emotional instability, impulsivity, and harmful self-soothing behaviors. Is it bipolar disorder, narcissistic personality disorder, antisocial personality disorder, or borderline personality disorder? What do you guys think? Okay, and it is a borderline personality disorder. Most of you guys chose bipolar. So let's talk about this. I'm going to tell you guys the difference in these personality disorders. So let's start with bipolar. Bipolar disorder, this is when the patient has extremes where they may be they have hyperexcitability, where they're in their manic phase. Everything is wonderful. They're so happy. They're excited about life. They want to go shopping, or they want to spend all their money, or they want to gamble, or they want to give their money away. That's the mania part, right? But then they can be on the opposite of the spectrum and go from that hyperexcitability to depression and sadness, where they don't even want to get out of bed. Okay. And so that's your bipolar disorder. Now, narcissistic personality disorder, that's when the person with their personality it's all about them. Everything revolves around them and what they can get out of a situation. It's all about them. Antisocial personality disorder. As much as you hear people say, oh, I'm antisocial, let me tell you something. This diagnosis is not the way that it sounds, because you think if someone's has antisocial personality disorder, they don't like being around people. But let me tell you something. Someone who is clinically diagnosed with antisocial disorder or antisocial personality disorder, they love being around people. Why? They are what I call social chameleons. They love being around people because they're con artists, and they are very good at reading people, figuring out whoever they're talking to, what they like, what they want, and they will turn into that person just long enough to rob them of whatever it is that they want from them. Let it be money, let it be sex, let it be property, right? They are con artists. So they love being around people because they're social chameleons, and that's how they manipulate to get what they want. That's your antisocial personality disorder. Now that leads us to our topic today, which is borderline personality disorder. Now, the people with borderline personality disorder, they don't know how to cope with feelings of rejection or hurt or anger or any negative feeling that they have. They don't know how to cope appropriately. So what they do is they'll do gestures where, they'll try to harm themselves. I don't want to say the word, but you know what I mean? What? Can I say it on here? I'm not sure. They'll want to harm themselves, right? But they don't really mean it. They do it for attention. But let me tell you something. A lot of the patients who die from that S word, killing themselves, they really didn't do it on purpose. The way it would work, so for example, let's say they're on the inpatient unit, they know change of shift is at 3 p.m. And so they'll time it to hang themselves or whatever way they plan on doing it, so that the nurse will come in time to save them, and then all the tension is on them. Okay. Something else that they'll do is, like, if the person that they're with, if they feel like that person's about to dump them or leave them, they'll start cutting themselves. They'll do these gestures. And so they'll harm themselves because they cannot cope with the stress or the emotions. And that is your borderline personality disorder. So it's very hard for people with borderline personality to maintain any friendships, any relationships, whether it's, romantic or not, because they have all these feelings, and at the very beginning of the relationship they want to dump all these feelings on the person. When the person's like, whoa, this is too much, they start to try to harm themselves to get the attention and get that person to stay. That's your borderline personality disorder. True or false? Unintentional deaths are common in borderline personality disorder. Is this true or is this false? Very good. This is very true. Many, many, many of the deaths are by accident, where they timed it wrong. They'll ingest a whole bottle of pills and they'll think the boyfriend or girlfriend will be home in time to, call 911 and save them. And maybe something held that partner up at work. And so they never showed up. And so they die unintentionally. Very true. Select all that apply. What are the other symptoms of bipolar disorder? Select all that apply. And guys, you know how to treat select all that apply. You have to treat them as true or false. So unstable relationships, antagonism, hostility, anger in relationships, physical violence towards partners, intimate or non-intimate, intense fear of abandonment, feelings of chronic emptiness, suicidal behaviors or gestures, impulsivity, suicidal gestures. What do you guys think? All right, let's talk about this. All of these are true. All of these are symptoms of bipolar disorder, and you guys have to recognize that. So, of course, unstable relationship. I already explained to you what this personality is like. They're not going to be able to keep relationships for very long. The minute there's a hint of something going sour, there's a hint of disagreement, they're yelling, they're screaming, they're trying to harm themselves. Physical violence towards partners. Yep. Intense fear of abandonment. They will call the partner a million times, and if the partner doesn't pick up one time out of that million times, they'll feel like the partner's going to dump them and they'll lose it. Feelings of chronic emptiness. It's never enough. Suicidal behaviors and impulsivity. Suicidal gestures. True or false? An unusual feature of bipolar disorder is splitting. Is this true or is this false? Oh, guys, I made a mistake because most of you guys did the same thing too. You chose true, but the questions didn't say a usual feature of bipolar disorder. It said an unusual feature of bipolar disorder splitting. And splitting is not an unusual feature. It is a very, very, very common feature. So I even made that mistake. It should have been false, but I understand how you guys could do it. I did the same thing. So let me talk to you about this common feature of bipolar disorder that's known as splitting. Now, splitting can mean two things, and I'm going to explain it to you. The first one is where everybody is either good or everybody is bad. And what I mean by that is while you're making them happy and you're doing whatever it is that they want, that they makes them feel secure in the relationship, you're such a wonderful person. But the minute you do one thing that they don't like, all of a sudden you're the worst person in the world. So in your position, you'd be the nurse. So as a nurse, as long as you're giving this patient whatever they want on the floor, you are the best nurse in the world. You know, everybody is horrible. Nobody else knows what they're doing. You're the best. But the minute you tell that patient, no, you can't do this, it's against the rules, you're the worst nurse in the world. You're abusive. You're this, you're that. That's one way of splitting. And another way of splitting is actually splitting, trying to divide the staff, where they'll tell you something about the other nurses and tell the other nurses, something about another group of nurses, trying to split the staff, because we know divide and conquer. And so that is something that we also see with these personality types. So as a nurse, you have to be very careful with the patient that has borderline personality disorder, and you cannot bend the rules for them, not even a little bit. Okay, so this is a very common feature in bipolar disorder. I'm sorry about that mistake, guys. True or false? Patient with bipolar disorder can easily control their anger and hardly engages in arguments, loss of temper, or physical fights. Is that true or is that false? What do you guys think? Okay, most of you guys got it right. We know that's false. They can't control their anger. That's why they have the suicidal gestures. That's why they cut themselves. That's why they throw things, at you the moment that they're upset or they don't get their way, and they'll lose their temper and get into physical fights. This is true. So saying that, they hardly ever do this, that's a false statement. What's a priority nursing intervention for the patient with bipolar disorder? Is it assess the patient for comorbidities, allow them to verbalize feelings, demonstrate effective coping strategies, or assess for suicidal or violent thought towards others? What do you think the priority nursing intervention would be? Great. Most of you guys chose the correct answer, assessing for suicidal or violent thought towards others. At the end of the day, whenever you guys get a test question asking about priority, always go back to Maslow's hierarchy of needs, physiological integrity. What is going to keep your patient alive the longest or kill them the fastest? So in this situation, yes, assessing them for comorbidity is important. Allowing them to express their feelings are important. Demonstrating effective coping strategies, they definitely need that. All of that is important, but it's not going to take priority over keeping them alive, assessing for suicidal or violent thoughts towards themselves or others. Select all that apply. What are some subjective assessment findings in the patient with bipolar disorder? Select all that apply. Don't forget, guys, you're going to treat select all that apply as true or false. We're looking for subjective assessment findings. The patient states, I feel empty inside. Cuts on the wrists, ankles, and labia. Requests a new nurse stating the current one hates me. That's splitting, by the way. Observed trying to seduce a male nurse on the unit. When angry, states, I'm going to kill myself. Breaks unit rules. That said until, but it's supposed to be unit. Breaks unit rules. What do you guys say? Okay, guys, so let's go over this. The correct answer is patient states, I feel empty inside. They request a new nurse stating the current one hates me. And when angry, they state, I'm going to kill myself. The key word here is this right here, subjective. Subjective is what the patient says or what they state that they feel, right? You can't measure anything that is subjective. If it said objective, we would have been dealing with this three, because you can see the cuts on the wrists, the ankles, and the labia. You can see them trying to seduce a male nurse on the unit. You can see them breaking the unit rules. So that would be objective. But because it said subjective, it has to be something that the patient states. And that's why these three are the correct answer. So be very careful, guys. Read very closely. What would be an appropriate nursing diagnosis for destructive behavior towards others and difficulty in relationships? Would it be ineffective coping, risk for suicide, risk for self-directed violence, or self-mutilation? I'm going to give you a hint. Read the entire question. I'm so proud of you guys. You guys chose the correct answer. I thought most of you guys were going to get tricked and go for risk for suicide. But look at the nursing diagnosis, what they're talking about. Destructive behavior towards others, difficulty in relationships. Why is this happening? Because they don't know how to cope with the emotions that they don't like to feel. And so they have these outbursts that are inappropriate. So very good, ineffective coping. At the end of the day, that's the bottom line when it comes to borderline personality disorder. You guys are doing great. 2 more questions. True or false? Borderline personality disorder is curable. Is this true or is this false? Is borderline personality disorder curable? False. There's no cure for borderline personality disorder. There is behavioral therapy, there's cognitive therapy, there's medications depending on the patient's symptoms. So, if they're, anxious, they can get anxiolytics, so on and so forth, but there is no cure. All right, guys, we're down to our last question. True or false? There are medications specifically approved by the FDA for treating borderline personality disorder. Is this true or is this false? It's false. There are no medications specifically for borderline personality disorder. That patient that has borderline personality disorder, like I said, if they're having trouble sleeping at night, they'll get, they may get like an what am I looking for? It's not coming to me. The medication we give to help them sleep. It's not coming to me, guys. But if I remember, I'll say it. They'll get that, or if they're feeling anxious, they'll get anxiolytic. Depending on the symptom that they have, they'll get medication for that. But there is no specific medication specifically for borderline personality disorder that patient is treated symptomatically. Okay, hypnotic. That's what I was thinking of. They'll get a hypnotic agent. So it just depends on the patient's symptoms, and they'll be treated accordingly. You guys did an absolutely wonderful job. And I promise there are more Kahoots coming where I'm going to be covering all of the personality disorders. Borderline just happened to be the first, but just keep a lookout because there are more that will be coming soon your way.